Hello and welcome back to Instagram Live with Intimate Rose. I'm Dr. Amanda and today I will be joined by Jaclyn of the Lost Labia Chronicles. Jaclyn is going to be sharing about a condition called lichen sclerosus. We'll talk about her journey and the amazing advocacy work. Instagram. Jaclyn has a PhD in scientific research analysis, and this has empowered her to really evaluate the scientific literature and understand it and advocate for others. Hi, Jaclyn. Welcome.
Hi, how are you doing?
Good. I was just talking all about your education and the amazing work that you do. Thank you so much for joining me today.
Oh, thanks. It's my pleasure. Happy to be here.
So today we're discussing lichen sclerosis.
Mhm.
Of course, I have my vulva model and my pelvic floor
Of
model.
course.
And then I also have fun tools that we can discuss for
Amazing.
management as well. But I did a very brief introduction of yourself. Would you help people understand your background and who you are and what you do?
Yes, of course. So, yeah, my name is Jaclyn, and I started having symptoms when I was in my early 20s. And for me, initially it was kind of manifesting more as discomfort with sexual activity. I wouldn't use the word pain at that point, but like something just didn't feel quite right, but not enough to alarm me. As the years went on, though, that discomfort definitely moved into what I would start to say was pain. So it was very burny type pain. I had a lot of burning with kind of intercourse type activities, but I also tore open at almost every attempt. And that was, well, A, it was very distressing, but it was also very confusing because when I would chat with, my friends, I was like, why don't they ever talk about the tearing open part of sex? Why aren't we talking about that? And so I did try to, get some answers from healthcare providers. I was in and out of different clinics for about 10 years. I was constantly told that you're just stressed. You're really type A, and if you could just learn to chill out a little bit, you'll see this will all just go away. Or it's normal and okay for women to have some pain. Just have a glass of wine and you'll be able to get through it. So I kept kind of in and out, and I would go to even STI clinics because initially I had very poor sex education. And back then, I thought if you had symptoms in the vulvovaginal area, you're dealing with a yeast infection or you have an STI. I didn't know there was anything else really. So I was thinking it has to be an STI. They're missing something. So I would often go to STI clinics, get a panel done. The panel would come back negative and I would actually be disappointed. I would go into those clinics really hoping that they would tell me you have an STI, because then there would be a name for what I was experiencing, but also there would be something I could do to help alleviate the symptoms and bring back my quality of life. But time and time again, it was, you're fine, there's nothing wrong with you. Fast forward to I'm doing grad school, it's my PhD. I moved to Toronto, Canada, and I find a clinic that allegedly specializes in kind of women's healthy type stuff. So I thought, oh, maybe this is where I need to go. Let me try here. And so I went in. It was a walk-in. I was the first one there. It was like 7 a.m. Had my coffee, first in line, so gung-ho. They're probably like, what are you doing? But I just wanted answers. So I get in, and the clinician took my history, and then in her defense, she did do a full exam of the vulva, but then said to me, yep, you look fine. There's nothing wrong with you. I can't do anything. Have a nice day. So I was like, okay. So I was about to leave, and she goes, oh, well, you could have multiple sclerosis, but in any case, I can't do anything there either. So have a good day, which really threw me through a loop because my mother actually had multiple sclerosis growing up, and she passed away when I was 21. And so because MS can be genetic, that really messed with me, right? Because now I'm thinking, okay, I have something wild going on with my vulva, but now maybe I have the same autoimmune disease that, my mother had. So I left there pretty distressed, but I also left there saying, cool, I'm done. No more healthcare providers, because this was 10 plus years now where I was told that I was the problem. And at this point, I truly believed that I was. I was like, I mean, this is like a women's health place. And she said I was completely fine. So this really must be a me problem. And there's clearly nothing that healthcare providers can do for me. So I kind of resigned that that was the last time I was going to talk about my vulvar issues in a healthcare setting. A week later, I finally got a family doctor, and I went to go see her, and I was actually there because I have degenerative disc disease. And so I wanted to talk about my low back pain, but I made an offhand comment about my vulva, and she said, hold on a second. Tell me more about the vulva stuff. We'll get back to the back, but I want to hear about the vulva stuff. So I told her pretty much what I had told you. And she goes, you know, as your family doctor, I'd like to be the one that says there's nothing wrong. Would you mind if I took a look? And at this point, I was like, yeah, I'm here. What's one more, right? So get in the other room, you know the drill, undressed, waist down, lie in the stirrups. She knocks on the door, comes in, not even 2 seconds of looking at my vulva, and she goes, Jaclyn, you have lichen sclerosus. And I remember saying, sorry, what? Because I'd never heard of that before. She then proceeded to do a full clinical examination, really looking at the clitoral area, the labia, and she was describing what she was seeing at the same time. So the clitoral hood had completely covered over and scarred over the clitoral glands. The labia minora, so the inner lips, had completely scarred to the outer lips, the labia majora. There was nothing left. At this point, all of the tissue, the vulvar tissue, was white, white, white. There was thick areas and areas that look all crinkled. And so she said, this is definitely textbook lichen sclerosus. Put your clothes back on. We'll chat in my office. She gave me the biggest little Coles notes. Here's what it is. Here's a prescription. Go see a gynecologist for follow-up. And I was out the door. And that first year of processing that diagnosis was definitely a big challenge for me, not only in terms of managing the physical side of things, but it was a real big mental health challenge for me. And we can chat more about these things later. I'm just giving a high level overview. But what I did notice was that when I tried to find information about my condition at the time, all I really found was medical articles saying use steroids. And I was like, well, okay, no, I know that part, but like, you know, how can I have sex again? What kind of underwear can I wear? Do I need to make any special considerations with respect to how I wash myself? All of these questions I couldn't find any real answers to. And a few months later, I connected with Lichen Sclerosus podcast. Kathy from Lichen Sclerosus podcast, and she slid into my DMs and was like, hey, I see you have LS. You should listen to my podcast. And I was like, okay. And then on her podcast, she put out a call for folks to share their story. And I was like, why not? Let's go. So I shared my story. And then a couple weeks later, she was like, I'm doing this virtual meetup for folks with lichen sclerosus. Would you like to join? Of course, I said yes. And after that first meetup, she was like, you're incredible and you need to come to all the meetups and you need to do this with me. And I was like, okay, let's go. And that was kind of my journey into the patient advocacy and support space, was through Kathy from Lichen Sclerosus podcast and then Lichen Sclerosus Support Network. And I would talk so openly about my struggles and what I was going through. Everyone was saying, you should start a blog, you should start YouTube videos. And so I did. And then fast forward to today, and I'm knee deep into patient advocacy. I do a lot of special training programs in North America and Europe for patient advocacy work. I am the Chief Research and Provider Relations Officer at Lichen Sclerosus Support Network, which is an LS nonprofit. I do a lot of content creation, and my content creation really focuses on knowledge translation. So going through the medical journals, reading through those studies, and then translating that into something that the patient community can not only understand, but feel safe reading. So not having any language that can be really, really triggering or upsetting, because you can read some of these journal articles and not only are they heavy on the medical journal, the medical jargon, but they also use words like disfigured that can be really, really hard from a patient perspective for us to hear those words being used about our bodies. So just making sure also that it's written in a way that feels safe, comfortable, and warm. So that is like my journey in a nutshell and how I kind of moved into the content patient advocacy side of this.
Oh my goodness. I'm so sorry for the way you were treated. I hear this every day, and
Mm-hmm.
it sounds similar to my journey, but differently. I have celiac, and I was also told you're a type A. I was in my doctoral program. What do you expect? You're
Mm-hmm.
stout. You have no money.
Right.
Like,
Yeah, which like fair, but also no.
right. So I'm so thankful for that provider that finally gave you the answers. And then additionally, you have a PhD in scientific method and understanding.
Mm-hmm.
What a tremendous gift that you're giving people by helping them to better understand it and understand in a way, as you mentioned, that is warm and approachable and not triggering and detrimental to their mental health. And
Yeah.
then you touched on the mental health aspect. Do you want to delve more into that?
Yeah, it's funny because I was just doing an interview an hour ago with a woman that has both lichen planus and lichen sclerosus. And we were talking about how challenging the physical symptoms are, but how the mental health side is almost worse. The feelings of shame, embarrassment, the feelings of, am I ever going to be able to have a relationship? What does this mean for my relationship? All of the fear and insecurity that comes with having a condition like this. And because we're often told at the time of diagnosis, you have LS, by the way, this can turn into cancer. Okay, bye. And that's it. No context, no nothing on prevention. And that lack of context is terrifying because when I hear this can increase your chance of cancer, I'm like, by how much? 70, 80, 90%? Am I guaranteed to get cancer? Is it a matter of time? I don't know. For the record, it's approximately 2 to 6% of people with untreated vulvar lichen sclerosus can go on to develop vulvar cancer. That risk is slightly above baseline population, but when you treat properly and consistently with topical corticosteroids, that risk goes right back down to baseline. And so that didn't take me too long to explain.
Yeah.
But, so that little bit of context really does make a big difference, though, because, again, some of us are thinking it's like an 80% risk, or I'm going to get vulvar cancer in the next year. And so a lot of us are just terrified, and that can set off kind of these health anxiety moments, which is definitely something that happened to me. A lot of depression and anxiety. We can see this in the quality of life studies that are out there, that we see there's a huge mental health impact and burden for folks with lichen sclerosus. And so that's something that I definitely try to emphasize in all interactions with clinicians and researchers. As as much as we need treatments, we also need support for the mental health side of things, because it can be incredibly challenging for many of us.
Absolutely, undoubtedly. And, such a frightening thing to hear on top of a new diagnosis that perhaps the
Right.
serious diagnosis for everyone with the cancer. So topical steroids are
Yes.
one of the known first lines of treatment for the tissue itself. What are some other either medications or over-the-counter methods that you have found to be helpful in managing LS?
So if we're talking from a personal perspective, my case is really lucky in the sense that I responded very well to first line treatment, which was for me was topical clobetasol. So I used that medication. That medication got my case into remission, and I still use it on a maintenance dose twice a week to this day. So I never had to go into second line treatments, which are topical calcineurin inhibitors. So they're a non-steroidal ointment or cream. They're going to work similarly to calm that immune response in the tissues, but they're not themselves steroids. So they can be nice for folks that either do not want to use steroids or who do not respond to steroids, because, there's no treatment that's going to work for everyone across the board. This is true for any condition. Even something as simple as penicillin for sore throat, right? Some folks are allergic to penicillin, can't take it. So it's not the be all end all. Same thing for steroids. I never had to move into the world of calcineurin inhibitors though, because for me, steroids just worked. So that was a big piece of getting me kind of into remission and getting me well managed. The rest I put together on my own. So as I left, I had that prescription for the clobetasol in my hand and I was walking back, and I remember thinking, I need to do two things and I needed to do them ASAP. I need somebody to help me with the mental health side because this is going to destroy me, and I knew it. And I thought, I think I need to go see a pelvic floor PT because I want to address the physical side of the painful sex. Because even back then, I knew that the vulvar tissues, it was more than just the vulvar tissues, right? Like, yes, that's the affected area, but all parts of our body are interconnected. And so I knew, that the pelvic floor muscles were probably involved in some way. And the reason I even thought of a PT, because my doctor didn't tell me this, was as somebody with degenerative disc disease and someone that loves working out and being active, I get back flares and I'm in those kind of clinics a lot, right? Where they have the RMTs and the PTs and the chiros and everything. So as someone that's lived so much time in those clinics, I spent a lot of time in the waiting room. And what do you do in the waiting room, at least in Canada? You look at the bios of all the healthcare providers on the wall. And I remember for years seeing pelvic floor PTs up with the rest of the PTs. And I thought, how peculiar. Like, everyone else is just a PT and they just do like the pelvic floor. That's interesting and strange, but never really thought much of it. And I would sometimes read the conditions that they would treat or like things they can focus on. And it would, list things like constipation and urinary issues, postpartum. But I do remember pain with sex popping out. And obviously that kind of stayed in my head as someone that had painful sex. And so I thought, well, if the pelvic floor is connected to the vulvar tissues and contributing to pain with sex, and if pelvic floor PTs can work with pain with sex, then maybe they can help me in some way, shape, or form. And so I did seek out a PT, and for the mental health side, I sought out a therapist, but specifically I sought out a sex therapist because I knew that a lot of the mental health concerns and anxieties that I was having were very much related to sexual health. Yeah. Because what we see with lichen sclerosus is we kind of see three buckets of people in terms of where their symptoms fall. So some folks fall into the itch bucket, where their main or primary symptom or the big bothersome one is the itch. Other folks are going to fall more into that pain category, soreness, irritation, burning type pain. And then others are going to fall into that sexual health category, where it's going to be pain, yes, but more related to sexual activity, decreased sensation of the clitoris, which is, we talked about that scarring of the clitoral hood. It can, in some cases, lead to a decrease of sensation. So difficulty with orgasm or muted orgasms can be a thing. And so I was definitely in that sexual pain bucket. And so I knew that I had a lot to work out there. And so I wanted a therapist that was kind of hyper specialized in the ways in which sexual health can intersect with chronic pain conditions, specifically those that, affect genitals. And so I did an afternoon of, Googling and narrowing down my top 3 and going on their bios and seeing who was a good fit. And I found one, and I think her dissertation was on like vulvodynia and all of that and how that intersects with anxiety disorders. And so I thought, well, okay, vulvodynia is not quite LS, but it's close enough and in that same world that I think that she'll be able to appreciate how this can intersect with my mental health. And so I went with her and was with her for 4 years, and she was a godsend, as was PT. So I think PT, sex therapy, along with the steroids, daily moisturizing, which I cannot emphasize enough. It is so, so, so important. Those were the real big pieces for me. I know some folks do have a dietary component to their LS. I'm not one of those. So we see it's kind of a 50-50 divide in the community, where some folks are completely unaffected by what they eat and others are very much so affected by what they eat. Bless, I'm in the category where I can eat what I want because I have the world's biggest sweet tooth, and giving up dairy and gluten and sugar would be so challenging for me. So those were my main things, although I can appreciate that for some folks, they may need to add the diet piece in there.
Absolutely. It can present a lot differently, and management can look very different outside of that gold standard of topicals. You mentioned moisturizers. I hear that you're a fan of our
Yes.
balm.
I don't know if you heard at first, I was kind of nervous because it's called Enchanted Rose, and I thought it was going to smell like rose, like potpourri rose, like really strong. And I was like, oh, I don't know how I feel about that. But it's actually so
Yeah.
subtle. The smell is so, so subtle that it's almost like completely neutral, but it's like just the slightest hint. So I was like, oh, thank God, because I was like, I don't know how I feel about like a bouquet of roses. And I know that some folks are like not the biggest fan of like moisturizers that have strong smells. So I was like, okay. But the consistency is just beautiful. I love it. And in my years, I've been moving more into the balm territory of things. So I used to be a coconut oil only girl. I still do coconut oil. It works for me and my body. I can appreciate that it's not for everyone. I'm not really a barrier cream unless I have like an active tear or fissure where I want to create a barrier between external irritants like chlorine in a pool, urine, and that open wound. But otherwise, I like the balms because the consistency is just so nice. It's so nice and like buttery and smooth. It also sticks to the skin a little bit better than say like an one ingredient oil, which to be fair, especially in the summer, oils do tend to run and drip and have a little less staying power, as I feel like the balms stay there, but they're not as thick as something like petroleum jelly or Aquaphor, where again, I'm using those more for barriers. But yeah, no, I love the Enchanted Rose Balm. It's amazing.
Yeah, it's all organic and made of natural ingredients. So any smell that you do smell is from the natural ingredients. We don't add any perfumes. So the subtle smell is a byproduct of a little bit of natural oils that are associated with healing. And then there is a little bit of different types of moisturizing oils. So it does, like you said, you like the coconut oils, and you can see I rubbed it in, and it's not greasy. It goes right into the
That's it.
skin. Yeah.
Yeah. And because a lot of folks too, what they dislike about the grease is that because it will kind of like leak, they find that like it gets onto their clothes and can sometimes stain the clothes, which I think is another nice thing about the balm having more staying power in that location.
Absolutely. And then dilators are often recommended in pelvic health PT for people with LS that are having pain with penetration that also have a little bit of loss of mobility of the tissues. When we think about penetration, we need good mobility of the pelvic floor muscles, which are skeletal muscles, just like your rotator cuff and just like everywhere else. So they can be weak and strong, they can be tight, and they can be rigid. And then we also have the skin itself, which is affected by the
Yeah.
LS. So the role of dilators is not just to provide a stretch. And in fact, I don't like using that word or that term. It's mobilization, because we're training the brain that something coming inside is not a threat. And that
Yeah.
speaks to the mental and cognitive piece of something coming
100%.
in. So we teach you how to coordinate and relax the pelvic floor muscles. We teach the sensory system that this is not a threat. And then we do gently mobilize the tissue of the vulva and then of the pelvic floor muscles themselves in service of pain-free penetration, whether it's tampon, speculum, or intercourse as well. A lot of times people think dilator sex,
Yeah.
but not everyone wants to have penetrative sex, or they might not want that right now, but they need to have that pain-free speculum exam for safety
100%.
reasons. So that's where even just using the smaller ones can be beneficial as well.
Yeah, and dilators were honestly a huge part of my journey with getting to a place where I could have pain-free sex, because I can now have pain-free sex, no longer tearing, no longer burning, everything is great. I no longer clench to the gods every time something comes near me. It also means that exactly if we need a speculum, no problem. I had to have a transvaginal ultrasound, and I had never had one before, and I was a little bit nervous at that time. And I remember thinking like, okay, well, you're using dilators. You can use the dilators the morning of. Again, for me, it's almost this like, it gives me the confidence, because I can tell myself like, okay, I put in the largest dilator this morning. When I saw the transvaginal wand, I was like, okay, I can definitely do that. Like, that's not a problem. So they really helped with those pieces too. But what I will say is the first time I worked with dilators was such a failure. And here's why. First of all, well, not first of all, like the biggest thing is I rushed into it too quickly. I really didn't allow the vulvar tissues to heal. And I went straight from buying a thing of dilators and sticking them in. And looking back, not only did I rush the process, but I think I also re-traumatized myself and reinforced those insertion equals pain patterns in my head, which led to more tightening. So of course I'm feeling, pain. But there is such a desperation that we can sometimes feel where we just want to get to that end goal. We just want to get the dilators in so that we could throw them to the side and then just do what we want to do, whether that's insert a tampon, whether that's insert a dildo, whether that's have sex with whatever it is, we just want to kind of get to that end goal. And I really didn't allow the vulvar tissues to heal. I really didn't allow the mental health to start doing some of its healing. And then I didn't take the time to really appreciate and learn how to slowly, safely, and gradually move through the dilators. Whereas, that's definitely, I did it right the second time, but the first time it was just like, but I didn't even know what I was doing. I went on Amazon and I was just like, cheap dilator kit, found whatever, and then was just like, okay, stick it, like, it was all wrong. So definitely gentle, safe. And there's so much work that I always tell people, like, there's so much work that can be done before you even stick a dilator into the vagina. There's so much work that can be done in terms of what you and your pelvic floor PT can do. There's breath work, there's, hip open, there's so much that can be done. And even just working on, the nervous system and the mental health piece and all of that. Because another thing that I found was, I remember at one point, I laid all the dilators out on my bed and then I just sobbed because I couldn't understand why somebody at 31 years old needed to use these tools just to be able to have sex. It didn't make sense to me. It didn't feel fair. I felt let down by my own body. I felt just there was so much built into it. So it's so much more for me anyways than just using this to desensitize the brain. There was so much emotional baggage built into these, tools that were laying on the bed. And so, I also needed to do some work on that, mental health piece and the avoidance and the fear associated with insertion. And my, nervous system was definitely on like high alert. So there's a lot that can be done even before we start doing the dilator work. But yeah, in hindsight, I definitely rushed into it way too quickly and didn't give my body permission to just do its thing for a little bit.
Absolutely. And they are so much intertwined and reliant on each other.
Yeah.
The mental, psychosocial, emotional piece can drive how the body responds because your brain says help and your pelvic floor says I got you.
Right.
And it guards to protect, and that's frustrating, but it's this very deep brainstem level reflexive response that kept us alive a long time ago. And it's very hard to unlearn. Teaching someone
It really is.
Yeah, it's much harder to learn how to relax the pelvic floor than it is to strengthen and uptrain. Coming down is the hardest part.
Well, so I was in pelvic floor PT, and during the internal exam, the PT inserted a finger and said, all right, basically squish my finger, do a Kegel, right? So no problem, death grip. And then she goes, okay, great. Now relax. And I'm like, okay. And she's like, she gave it like a few seconds. She's like, you can relax now. And I was like, I am. I did it. Like all proud, right? Like, where's my sticker? Like, I did it. I relaxed so fast. Aren't you impressed? Tell me how good I am. And she's like, no, you're still death grip. And I was like, oh, okay. And then it took me a whole 3 minutes to release that. And not only that, but I couldn't do it in one shot. It was like gradual. So like a little and then a little. And the amount of concentration that I had to put for that whole 3 minutes to get my pelvic floor muscles to chill, it really showed me wow. Because if you had asked me prior, do you have tight pelvic floor muscles? I probably would have told you no. Because I think that some of us think that we would feel it, and it's not necessarily true. And a lot of times that guarding, that clenching, that tightening is unconscious. We don't realize that we're doing it. I remember there was one time I was with my vulvar specialist, and she's a colleague of mine. We co-author on papers, we go on Zoom calls, for research. And so it's not like she's a stranger. I feel very safe with her. And she put her hand on my knee and said, okay, I'm about to start the exam. It's okay. And then she just went to go slowly with her hand. And then she went, okay, no problem. We'll just breathe. And I was like, what do you mean? And again, she's like, oh, girl, your whole pelvic floor just went like whoosh. And I was like, no, it didn't. And so and this is one of the reasons I really, really mentioned the importance of pelvic health for people with lichen sclerosus, because if you've been in chronic pain for years, the likely is there's a lot of tightness, a lot of guarding and bracing against that pain. And we don't even realize that we're doing it, and we don't even necessarily feel it. Like I had no idea. I was like, no, I'm not. And she's like, oh yeah. Like I saw them. And I was like, that's so surprising to me. So, I always tell people with LS, like, it doesn't have to be you don't have to do it the same day that you get your diagnosis, but get assessed by a pelvic floor PT, see what you're working with, and share what your long-term goals would be. And for me, my long-term goal, my biggest one was to be able to have pain-free sex. And so dilators definitely did come into play. And again, once I learned to give my body that permission it's going to take the time that I take. I might use these for a month and get back to it, or it might take years. And I'm just going to let my body do its thing. And I'm going to love and respect myself throughout this process. And if I'm stuck on the first one for 3 months, then so be it. That's where we are. And once I let go of those expectations and those timelines, that is, when things started to really start to open up for me in terms of being able to move through them in a way that felt safe and comfortable for me. And they did get me to a point where I am able to, have pain-free sex. And so I'm so grateful for them. And of course, now I've upgraded. I now have Intimate Rose dilators. I initially was working with that random, I don't even know what the brand is at this point. I don't even know if it still exists. But then I shifted after that to Intimate Rose, and I love them.
I'm so glad to hear that. We put a lot of effort into making the safest and easiest to use on the market. And I love the way that you provided that really grace structured paradigm, because most people want to know, how long is this going to take? Right. And you said it takes what it takes. And every person is different, and life events can come up and they're stressful, and it could take a little bit longer, but eventually all roads lead to reaching your goal.
Yeah.
And
yeah. 100%.
So you're telling me that the off-label use of the wine didn't heal the pain?
No.
Okay.
Amazingly, it still hurt. And then it still hurt the next day. And for years.
And
now, wouldn't recommend.
Yeah, 10 out of 10, don't recommend. And not a single pelvic health PT has ever made a prescriptive use of wine.
And you know what? I have to say that going to see a PT as a LS patient can be one of the most healing experiences in terms of healing medical trauma and medical gaslighting, because it was the complete opposite of anything I had ever experienced. First of all, I can only speak from a Canadian healthcare system, but I assume that the United States is pretty similar. You get way longer than 5 or 10 minutes. So at least for us, if we see a standard gyne, GP, whoever we're seeing, it's 5-10 minutes. If you get 15, wow, they were having a good day. Maybe someone canceled and they're in a good mood, because normally it's less than that. Yeah. So, my first initial evaluation was a full hour. And that really takes the pressure off me, because now I don't feel like I have to condense 10 years of symptoms and things into 5 minutes. Now I feel like, I can sit back and actually go through things slowly. But also, PTs are very trauma informed. Everyone that I've ever said was just blown away by how compassionate and trauma informed the whole process is, and it really puts the power back in your hands. You know, even down to the exam. You can decline a physical exam if you do not want the physical exam in the first place, and that's okay. There's still a lot they can do to work with you and help you get to your goals even without going in. But if you do want, you know, mine at least was like, I'll explain every step of the way what I'm doing and I'll check in. Is this okay? Can I go forward? Do you need me to stop? Do you need to pop? And it was just like, it really just put the power back in my hands, and it was something that I had never really experienced prior. So it was like the complete opposite. And I found that experience to be really healing. And I've heard that from so many people too. It's just, it's such a different experience. So, yeah.
We love having that relationship with our patients. It's more in depth. We do have more time, and we love taking that time. And we're here for you. We're not on a mission. Not that physicians are, but they are, like, they got to get that pap smear done and they got to move on. We're here in service of your goals. So if they are in a course or if they're not, that whatever it is, that's our job.
Yeah, and I always tell people too, like, because to your point earlier, not everybody's goal is to get to a point where intercourse is a thing. Like that might not be a thing that matters to them, or that they don't want to worry about that right now. But they might say, hey, I need to get annual pap smears, and I can't do it without tearing or without burning. So my goal, and maybe we're only working with the first two dilators for this, because that's all we need to do to get to that place, or to insert a tampon or something like this. And so there's just so many ways that I think dilators can really be helpful to the healing process and to achieving some goals, right? Like dilators are not going to be the tool if you want to eliminate itch, for example, but they can help with a lot.
Absolutely.
And so can the wand, which, by the way, I just have to make a really embarrassing confession. If you can show it on the screen for a second. So the first time I saw this, no joke, I thought you were supposed to put the whole thing in your vagina. Oh. And I couldn't understand from like a physical standpoint, because I've seen what the vagina looks like from the inside. And I was like, how does this get in there? And like, so do I have to open up like to a birthing level to like allow that to go in? I was so confused. And I was like, I don't know why PTs are recommending this. I don't know what it's supposed to do, but I don't think that's going to fit inside my body. And then I got one, the purple one from Intimate Rose, and I went online to see, like, how do you use this? And then I felt so silly when I was like, oh, you're only really inserting like this much, and the rest is a handle so that you can really have full control over where, and then it made sense to me. And then I was like, well, that makes a lot more sense than putting the whole thing in there.
Just about like that. Exactly. And then that's with the shorter end, and then here's the long end, and it just comes out and reaches the side walls and the deep aspects. So yeah, and then you use the other side, but both ends can go in, but not at the same time.
Yeah, and not like the whole thing goes in, right? And like that can be really helpful too for like releasing those tight trigger points around there. And your PT can totally, like, you can totally bring this to your PT and say, help me. Yeah, help me, show me how to use this on my body. You know, what do I do?
That's exactly right. PTs love it when you bring it in so they can show you, here's where your tender points are. Here's how you reach it.
Yeah, because I'm such a visual person, and honestly, I find it so helpful, even just if it's like a one-off. Even if you just show me in one, visit, here's where your trigger points are, and here's how you can use it. Cool. Now I feel good going home and using this on my own versus like unboxing and just seeing what happens.
Absolutely. That's a good reminder for our resources on our website, like you mentioned, where I have the videos showing how to use it on the model, and descriptions of body positions to try and all of those different things as well. So the product comes with a manual at the bottom, and then it directs you to our website. We've got hundreds of free resources on there.
And that's when I was like, oh, get it now.
Jaclyn, you are probably not alone, so don't you worry. When you see it online, it's hard to tell what's happening. It looks
and I just didn't understand. It's like, I don't know why anyone would want to put that whole thing in their vagina. Props to you if you can get it in.
Don't try.
No,
Don't
no.
try this at home.
Watch the resources video and use it properly instead.
That's exactly right. Oh my goodness. And before I forget, we do have a code after we wrap up for 10% off for our listeners and our communities here. So don't let me jump off without sharing that code that they can use on the wands or the dilators or
Amazing.
the balm and whatnot. But
Yeah, because I think those are great kind of adjuncts to bring into your lichen sclerosis kind of treatment and care. So, I always say like at the center, you're going to have your treatment, right? And that can look different for different people. For most folks, it's going to be steroids. For some, it'll be calcineurin inhibitors. I'm talking topical. We're moving into this new space of JAK inhibitors. There's kind of uncertainty as to how well they're going to perform with LS. Some folks that have dermatologists can get them prescribed off-label. But regardless of if it's a JAK, a calcineurin, or a steroid, it's kind of at the center. But I always say, you can throw all the medication in the world, but if you're not addressing these other pieces, and if we're not looking at this from a more holistic viewpoint, we're only going to get so far. And we really want to get like ultimate optimized healing. And to do so, we have that outer core where we're bringing in things like dilators, PTs, therapies, support spaces, moisturizers. Depending on where you are in your life, there may be a hormonal adjunct. A lot of folks with vulvar lichen sclerosis will have a topical estrogen prescribed as well as an adjunct, right? So it's not prescribed as the treatment, but topical hormones can be prescribed as an adjunct to help with the vulvar tissues overall. So those outer core things are still just as important as that treatment piece on the inside.
absolutely. Addressing both sides of the window.
Yeah.
Or the outside of the window and the inside of the window.
Mm-hmm.
Absolutely. Is there anything else that you'd like to share before we jump off?
I think that, if I could just mention that I did just recently launch an ebook that I co-wrote with a pelvic floor PT, and she's actually my pelvic floor PT. And we wrote a book on working with dilators when you have vulvar lichen sclerosis, because what we found was there were some how-to guides out there, but they were more focused on vaginismus and vulvodynia, and we really wanted something specific for the LS community. So, really addressing things like what happens if you tear when you use dilators, right? Like that's not going to be so much included in a vaginismus manual or vulvodynia because tearing isn't so much a thing for them. So what do you do about that? What do you do? How long after treatment can you start working with dilators? Can you put your treatment on and use them right away? Do you need to wait? So really all the ins and outs of working with them as somebody with vulvar lichen sclerosis, and it's incredibly comprehensive. We've got how-to videos, stretches, and, jaw release stuff. We've got nervous system work. We address the gut microbiome. It's it took us over 1.5 years to put this together. So it's definitely a big, exciting thing to finally see that kind of come to fruition. So that is on sale on my website right now. If folks want to get that, it is always there. And then I do have tons of free resources on my website for anyone that wants to learn more about vulvar lichen sclerosis, or if you have it. Tons of free content. Probably the biggest piece would be my free ebook on lichen sclerosis, which I do update annually to reflect any updates in the scientific community. So if there's like new RCTs that give us new insights, like that will be included. So it's always as up to date as possible. Again, it's very comprehensive. Over 50 peer-reviewed journals were consulted as I kind of put that together, really addressing everything, different adjuncts, things like platelet-rich plasma, phototherapy, all of these things, and also addressing that mental health side, that sexual health side, surgery, really all the ins and outs, and really created that for patients first, but also caregivers and healthcare providers as well. And that's free and will always be free on my website. So I think that's also a nice resource to have for folks.
Absolutely. Can you share your website?
Yes, it is lostlabia.com. Lost Labia Chronicles, because I did lose all of my inner labia to lichen sclerosis, which was initially devastating for me, but working on that in therapy really got me to a place where I reached 100% acceptance, and actually I love my lost labia now. So calling it that was kind of a way for me to reclaim a part that felt really devastating and tragic for me. So yeah, lostlabia.com, and then you can find all the resources there.
I love how you frame that, Jaclyn. And the LS community is so lucky to have someone that is able to translate all of that research. I hear your hunger for the most
Hmm.
recent evidence,
Yeah.
and being able
Yeah,
to like digest it is a special skill, because even someone who knows how to read literature can't necessarily evaluate the quality. Sometimes it can be tricky.
that's
As someone
it.
who's
That's it.
published, I can appreciate,
Yeah,
when you're reviewing other people's work, sometimes it's like, oh, what did this really look like?
100. Yeah, and also, there are also people in the community who have the same, similar, or even better skills than me. But if they're newer in their journey, their emotions make it such that they can't even touch those medical journals. And I was like that initially. I could not look at those. I had to get to a certain place with my mental health where I could read them from this kind of objective, neutral lens. And so for some people, it's just, yeah, I can do this, but I don't know. I don't have the headspace for this, or I can do this, but I don't have the time.
Yeah.
Just synthesize everything for me. Tell me what I need to know. Tell me where I need to go, and that's good enough for me. So that's for folks out there too. You just don't have enough time, and you just want to get the Coles notes. I can do that too.
I love that. Here in the US, we call it Cliff's Notes. Isn't that
Oh, Cliff Notes.
that way?
Okay, that's good. Yeah. I always say Coles Notes. I didn't know that there's a difference between the States and Canada. That's good to know, because I talk to a lot of Americans. So Cliff Notes. Okay.
Yep.
And then there was Spark Notes too. I don't know if you guys had
Is
that.
it about
No,
dogs?
clearly no. No. It's basically like the same thing. I think like Spark Notes came first and then Coles Notes
Oh,
maybe, or something. But it's like very similar. I think they were like competitors. But I think you guys are just like on the Cliff Notes.
yes.
That
Cliff's
works.
Notes was the original synthesis of things, and then
Yeah.
we cut it down to Cliff's.
Right. Ah, Cliffs. Got it. Awesome. Well, thank
Oh,
you so much. And thank you for, the opportunity to raise awareness and let folks know about this condition that, for a while we've said is rare, but is definitely not rare. We know it's not rare. And, thank you to Intimate Rose for just creating such a wonderful spectrum of products that we can include, again, in that outer sphere to really help us get that holistic care and comfort.
thank you so much for the kind words, and thank you for all your amazing work and for your time and expertise today.
Oh, and
And
discount code.
our code is better. All one word, feel better. And that's for 10% off of our website for dilators and balm and wands. Additionally, we do offer telehealth physical therapy services. Currently, we just started up here in the US. So if people are looking for access and they don't have one close by, or they're not feeling up and ready to in person have a PT, we are trying to build that bridge. And so we are offering online telehealth services
That's
here at Intimate Rose.
amazing.
Yes, brand new. We are very
Yay.
excited. Yes. All right. Well, Jaclyn, thank you so much. I'm sure that we will see each other again, hopefully at a conference or
That'd be
something
amazing.
soon. But
Yes.
we sure appreciate you. Thank you so
Oh, my
much.
pleasure. Thank you.
Have a good rest of your day.
Bye.
Bye.